Welcome to Meddkit's Provider Spotlight, where every week we are interviewing the most amazing private practices from all over the United States. Every week we bring on someone brand new, different specialty, but most importantly, we get all different perspectives here. We get to learn new things. We get to explore what makes all these different private practices unique. And we have two very special guests today. I want to introduce you to Vilia and Alina, who are the owners of the Center of Revitalizing Psychiatry. So, welcome, you two.
Good
Thank,
morning, Rachel. Thank you.
thank you
Good
for having us.
Good morning. Yes, I'm so excited to chat with you both. It's such a treat to always have two, the more the merrier. But I know we have a lot to get into, so let's get into it. I would love to maybe start us off with I'd love to hear about your background, like what had got you here? What is your story? So what excited you about jumping into mental health and opening your practice?
I'll take that one. I think really for us, it's our family because our mom, Dr. Marina Tourkova, is the one who started the practice 23 years ago. She comes from a family or a line of psychiatrists. Her father started the first department of psychiatry in Lugansk, Ukraine, the country that we're both from and our family is from. And, we followed her footsteps. When we had time to explore our careers, we decided that, family business is really amazing for both of us to be in and something really exciting to explore. So we continued the family tradition and we've taken over the practice and are really excited to grow it, expand it, and really bring exciting, amazing services to our clients.
Oh, that is so nice to hear. And it's so wonderful that it's such a homage to, your mom and family and being family owned and operated and kind of letting that seep through, your organization and know that people feel comforted when they come in, being in mental health, it's all about that, right? And creating that safe space. And I'm sure you're carrying your mom's legacy through what you're doing today in a great way. So that's really exciting. I'd love to hear. I know that you both are together, but you have multiple different locations. Where are you all located?
So we have three locations. Our first office that opened 23 years ago is in Rochelle Park, New Jersey. Our second office is in Sarasota, Florida, and we have our brand new office that's in Murray, Utah, right outside of Salt Lake City. So we kind of cover, the full geography of the US at this point, and it's been really exciting to watch it grow.
Oh, that's so awesome. Coast to coast, you guys. That's amazing.
Right.
I love it. But I'd love to hear a little bit about, your practice and, what would you say that people are most commonly struggling with, or what are your clinicians you feel like really working on with your patient and client population?
So we cover most of mental health disorders and issues and symptoms, but the three most common are depression, anxiety, and bipolar disorders.
Mm-hmm.
There are, of course, additional ones and sometimes combination of two or three, but those are the most common disorders that we cover. And we do see adults and children.
Mm,
Uh, we we see these disorders, unfortunately, across all ages and across the country. And
yeah.
probably, this is not just in the United States, as we know. So yes, those
Yeah.
are the common ones.
Yeah. And just to add that there, mental health is so wide ranging, we do tend to hear a lot about depression, anxiety, bipolar, but there's so many other things that people experience and have. And as a practice, we cover the full range of mental health services. And in addition to psychotherapy, we provide medication management. We also have groups and we have intensive outpatient programs. So we're really a comprehensive mental health practice that treats really everything except, kind of very high level or of care that is not suitable in an outpatient setting, but everything that's in an outpatient setting, we pretty much can address.
That's really interesting because I feel like folks like yourselves are far and few between. There's always this gap in between services. Like there's some people that do, maybe just talk therapy, but then there's people that just do the medication management portion of things. And it's hard to find something that is all under one roof where you can kind of be taken care of. Which I think probably gives some continuity for your patients. Yeah.
Absolutely. Yeah. One of the great things about our practice is because first of all, we have a very diverse team in terms of their specialties and
Mhm.
things that they can address and ages that they can work with or diagnoses that they can work with. But we also, the fact that everyone is part of the same team, we have a lot of continuity between the providers where, they can really take this team approach. And if you are, having psychotherapy, then and you're seeing a medication management provider, those providers can also say, hey, well, I think this would work really great because you're doing the following things, and they're all on the same team in terms of client care. So it is really quite important. And we've had patients where they would move or leave the practice, and then many years they would still come back and say, I love being treated here. So they end up coming back and continuing care with us.
That's so sweet. It's so nice to have also people return and just know that this is a safe landing spot for people to always come back to, whether, they feel like they have graduated maybe at some point and then say, okay, I think I need a little bit of a checkup and I need to check in. And that's really great that you have been here also for such a long time and has been such a staple in your communities. But for people know that they can always come back to, which is a great testament to you all. And just kind of alluding to all that, you've already shared, how you're so unique in terms of your services, but I would love to hear about how your approach is, different from, maybe others around you or something that you feel like is special and unique to yourselves.
Sure. Of course, so as you may know, we're family owned and operated. And
Hmm.
so my sister and I took over the practice from our parents. And I think that gives the practice completely different approach as opposed to practices that are owned by corporate or perhaps,
Yeah.
more on a business level. With our approach, it's very patient-centric approach. And for us, it's very easy to adjust and adapt to the needs of the clients and our patients. We can quickly put a group together if we see something going on in the world or there's some kind of turmoil, there's a distress of some way, we can easily put a group together to provide that support that one of our community may need. At the same time, because we have so many providers, if one provider is not available or may not be the best fit, we can easily find a substitute.
Hmm.
So with our approach, it's all patient-centric. We can also adapt to schedules. For our program, intensive outpatient program, it runs at certain hours. But for example, for the adolescent intensive outpatient program, if for most adolescents or teens, the time is not the most convenient, we can easily rearrange because everything is done in-house. We don't have complicated structure of our business. And so we can easily adapt and make it what's best for the clients, of course, with the convenience of the providers.
That's so important. I feel like especially today where we're all so pulled in different directions and it might be hard, there's like a barrier to entry, right? If something doesn't work very easily, we're like, nope, can't do it. We easily back out if it's like just a little bit scary. And so I think it's so great that you've really centered your universe for your clients and know that there's so many people out there that can help them. And if maybe someone isn't the right fit, you have so many people that work with you. And I can see, how much the family piece means to you. And I think you incorporate that with, all your clinicians and how close you are and what you're seeing within your communities and how you can easily dive in and say, how can we make a difference? And I think obviously that's why people come back. And
I think another thing that I forgot to mention, because there's two of us,
Mhm.
so we always help each other out and we always cover for each other. So I think there's always support to our staff and team, and also there's always support to
Yeah.
each other. As you know, that's one of the challenges in life when it comes to mental health, lack of support or improper support. So having each other with the same direction and vision, and sometimes lack of vision for one person, then the other person will help out. So I think that makes us even more unique, having each other and providing support to our community.
Yeah.
That is so sweet. Gosh, that was so nice. Oh my Lord. That was, I mean,
Don't tell anyone.
don't,
It's
never.
love.
This isn't going live at all. It won't go out to the world. No, but I mean, I think that is so unique. It's so rare that you get, a really great business partner in life, right? That's hard enough, but also to be family, and to work well with each other and to be each other's support. But then yes, there is, that business aspect to it where you're juggling a lot. You have multiple locations. And you have multiple therapists and everyone needs support. And so it's so great to trade off, your strengths and weaknesses and saying, okay, you're really great at that. You're gonna do that. I'm better at this, so I'm gonna do this. And that's what kind of makes the world go round. So that's such a beautiful testament to how you've built things up. And I think a lot of the clinicians and business owners that are watching today, it's something to admire, because it is really hard to find in life, as you're starting things up. It's not so easy, even though your mom has paved a pathway. You've had to continue with that, and that's really hard too. But I'd love to hear, kind of taking a hard right, into a new subject. I love to hear about, I think every specialty tends to be plagued with old wives' tales, maybe some misconceptions about what they think that thing is. And I think mental health, there's quite a bit of them. I think there's a lot of, oh, my friend had this experience. Is it this? Or I read about this online. ChatGPT told me this. And what do you think about that, Dr. Google? And so it's kind of complicated at times. And so I want to hear from you both, what do you or your clinicians see on a day-to-day basis of what the misconceptions are in mental health therapy, all of it?
So I think one of the most one of the most common misconceptions is that for you to seek help with mental health, you have to be really kind of, really have hit the very bottom, right? You have had something extremely traumatic happen, or you've had, something devastating, and I think our message in general, or in mental health field in general, is so first of all, it's okay not to be okay, right? So this idea that, we can be off in different parts of our lives. We can have different things happen. They don't have to be extremely traumatic, but we can have things that happen in our life where we need to seek professional help. And it doesn't have to be this big thing that, oh my God, and until that happens, I will kind of, pull myself up by the bootstraps and I will keep, tugging along. So mental health is really quite diverse in the support that you can receive. Sometimes it could be, being overworked and overstressed at work, right? It could be anxiety because, maybe your finances are not in the best place. Maybe it's just a phase in your life where, your kids are small, the job is stressful, the marriage isn't working great. There could be a lot of things that are impacting our mental state, and it's okay to seek help for those things. It doesn't have to be, something, this big event that happened and, oh, that's why I'm traumatized, right? I think that's one of the big misconceptions we've seen. And the other misconception at least I've come across personally, is when we talk about psychiatry, where I think therapy is being more accepted in our society, we're talking more about getting help and it's okay. But when we start talking about psychiatry and medication, people tend to be like, ooh, am I going to be, zombified, or am I going to be on this medication that's, going to affect my functioning and somehow I will not be able to function. And there's quite a lot of medications out there that really help to, for us to manage just things that are going on in our life. People may be a little bit disbalanced in terms of the their brain chemistry. And there's nothing wrong with, having the right provider, a professionally trained psychiatric medication management to manage your medication. I mean, I'm repeating a little bit, but the idea is that these medications help to really achieve a higher quality of life. And there's nothing, just like we would take a pill if we have a headache, or if we have inflammation, we don't think twice about it at this point. This is in psychiatry, somehow you still get this very pushback. Oh, I don't want to be on medications. So
Yeah.
this, one of our strong messages is that in psychiatry and in psychotherapy, it's okay to seek help. It's okay. You don't have to wait for a big event. And at the same time, medications are not as scary as they were, I don't know, years and years ago. And at the same time, medicine has evolved so much over the last 2 decades that it's really amazing how it changes people's lives today.
And I
It's,
think to add to that, sorry,
yeah.
Rachel, but to add to
No,
that,
yeah, I want to hear.
I think there's one of the misconceptions is that psychiatric medication is just like any other medication when it comes to when people look from a different angle, especially from treatment. So sometimes a person will come to their primary care or even, I don't know, dermatologist or any kind of doctor and say, hey, can you prescribe me a medication so I can sleep better, or so I think I have an ADHD, or Google told me I have ADHD. Can you prescribe me Adderall, for example? And I
Mm-hmm.
think it's also misconceptions, the fact that not every physician or clinician understands psychiatric medication the way a psychiatric medical provider would be able to prescribe. So it's just one of the things that it's not all medications the same, just like a psychiatrist will never look at cardio issues because they're not trained for it, they don't have experience. So psychiatric medication is not like every medication, especially because there are obviously different side effects and everything else, but it has to be properly managed. So it's important to go to a proper provider with experience and training.
It's so
Yes.
important that you brought that up. Sorry, Alina. I think and I want you to continue because I think this is such an important topic. And it's funny, like we've had, some other psychiatric providers that have come on, but we haven't had like a huge emphasis on medication management because, again, like there's a large gap in between people that can provide that all into one roof. So I'd love to hear, Alina, a little bit more about, some of the misconceptions or continuing on with medication as well.
Well, just to add to that, I
Yeah.
was going to say that we've actually seen over the years quite a lot of patients
Mhm.
that come to us and they've been on psychiatric medications for years, and the psychiatrist or the psychiatric nurse practitioner will say, "Who is prescribing this?" And they'll say, "Oh, my PCP." And they're like, "Well, this is why, it's not really working, because you're on these huge doses of medication that is maybe not serving exactly what you need. It's either you haven't been properly diagnosed with a certain condition, or the dosage hasn't been properly adjusted given everything else that is going on with that patient." So it would take us, when we see a patient like this, usually within a month or two, they say, "Oh my God, this is like life changing." But the only thing that, what was really wrong is the dosage was completely out of whack, or the medication that they were on was completely out of whack. So we always encourage patients and providers, say, if there's because a lot of providers will diagnose a psychiatric condition, they'll ask you, they'll ask you anxiety or depression questions, and they'll say, "Oh, you may have it." We really encourage people to seek professional help from a specialty that you're being diagnosed in. So if your PCP diagnoses you with, whether it's anxiety, ADHD, bipolar, sleep issues, anything else, come to a psychiatric provider, and they will manage your medications, because it will serve your mental health and your physical health needs much better. So this is a very strong message.
Yeah, I really appreciate you going into this because I mean, this is why it's so wonderful to interview all different folks in different specialties. And I know that sometimes there's, bleeding lines on occasion in terms of what people can do, but then there's also the moral aspect of what you should do. And even though you could do it, doesn't mean you should do it. And so I think it's about also staying in your lane too, and whether you are a PCP, I think this is like a great also reminder for folks like why you can prescribe. Doesn't mean that you shouldn't send your patient off to someone who is a trained professional in this one very specific area, and that might be better suited to, help your patient because, as you said, I'm sure people come very over medicated, and that's affecting them. And generally probably not for the better. And so it's important to talk about, and I really appreciate, yeah, I think like talk therapy, I think, hopefully we're trending in a better direction in terms of this, stigma towards it and, more people are getting help. But yeah, you don't need a rock to come through your glass window in order for you to seek help.
Right.
I think that's another huge message that you both have brought up, and I can really appreciate that because yeah, I think sometimes like you said, Alina, like you get up by your bootstraps and here we go again. We're doing it again tomorrow, and it doesn't have to be that way.
Yes.
And you can get some resource, but the medication piece, yeah, I think you're right that part is still kind of in the past, and we're still holding on and harboring on to those feelings of, yeah, you're not going to stop taking your heart medication for
Mhm.
your murmur, or
Right.
you're not going to think twice about popping the Advil that you do when you have a headache. So why is anything else different if it's
Yeah.
going to help you, you know? Yeah, it makes a ton of sense. I appreciate it. But to round things out today, just as it's such a treat to have both of you here and really get professional insight into your world, and would love to leave folks with two pro tips from the pros. And so maybe there's something that you can share with us for, I think, both subsets of people that are watching today, both the patient side of things, but then also, the provider side, people that own their own businesses. It's tricky land to navigate.
It
And
is.
so maybe you can share some things that are helpful for maybe classic homework or some things that you might share with the patient that will help them improve their mental health trajectory, moving upwards. But then also for the folks that own their own businesses, what's been the success for you guys? What's been something that you're like, mesh, I just couldn't like I couldn't do this every day without this one thing, whatever that might be. So I'll let you two respond in terms of your two pro tips.
You want to take the patient side?
Okay. So in terms of patients, of course, everybody's different. We're all different creatures. We all build differently, think differently. But we all come across sometimes somewhat common issues, so experience common symptoms. I
Hmm.
think one of the most common ones is anxiety, because that's something, it sounds very clinical, but in reality, it's something if I'm afraid of something or like I don't know how to handle it, anxiety sets in, and sometimes it can become a panic attack. So one of the things that we recommend people before it becomes a panic attack, as soon as people start to feel nervous or just like, I don't know what's going on, or like sweaty palms or anything like that, the best thing to handle it non-clinically at that moment is to distract yourself. And
Hmm.
there are different ways to distract yourself on your own, even when you're starting in the panic mode. One
Hmm.
of the things, and I actually learned it recently from Alina, one of the things is perhaps to have a sour candy in your pocket, and you just literally pop in very sour candy, and your senses get overwhelmed with the sourness rather than concentrate on the problem. It's almost like you're putting your brain in the shock mode and you forget about all your other problems because this is so sour. And perhaps it could be, I don't know, a red pepper. It could probably will work as well. It depends. Could be different side effects, but just get your mind distracted from the situation rather than dwell upon it or talk to like at this point,
Mhm.
like, oh my God, you won't believe what happened. Just distract yourself first, and then this way you'll be able to concentrate. So it's kind of like a quick
Yeah,
tip.
Oh,
yeah.
Yeah.
I
I
love
So
it.
thank you for
love
thinking
that.
about it.
Who also doesn't love candy? I think everyone's going to be on Amazon, like sour candy, warheads, lemon head,
Yes,
like where
Sour Patches, yeah.
Sour
Extra, extra.
Patches.
We should start selling those, I think.
I know you should have them in the office. Oh my gosh,
For those
that's
that won't
actually
take medication, just here's candy.
just here's the candy. There's yeah. No, I think that's so smart. I haven't thought about doing that. And I think that's such a neat, yeah, all right, Alina. I think
Well,
that's
it
such
wasn't mine. It was actually one of our providers that was suggesting this, and she shared it with me. So it is clinically based.
no, yeah,
Highly
scientific.
recommended.
But I think that's so awesome because I think, yeah, like I think to your point, Vilia, like there's sometimes you just have like a freak out moment and you're like, oh my gosh, this is happening. It's happening to me. I can feel it in my chest and it's coming together, the full-blown panic attack of, and yeah, I think to have that hard reset. And it doesn't hurt that it can be a piece of candy. Yeah, I think that's super, super smart to be able to say, okay, like let's move on from this feeling and do something completely new with my body and have it experience
Mean,
something else
you will
very
still need
quickly.
to process whatever's going on
Oh
and
yeah.
feel it, right? But it's just it's a in that moment to give your brain kind of a momentary reset and
Yeah.
refocus. And then of course you will still need to address, the
Yeah.
issue. So it's
And
it's
then
not a
be a professional.
that's right.
Yeah. Candy first, see a professional. I'm just
Yeah.
kidding.
And I
Yeah.
think for the practice owners, I think one of the things that Billy and I both have experienced over the years, and I think this was a great lesson for us, is when things are uncomfortable, that's when you're growing. And
Mm,
so when things get kind of like, oh my God, what are we doing? There's so much going on. That's actually a good place to be in. It's not going to be a forever place, but that means things are changing. Things are dynamic. Things are, it's forcing you to, in most cases, grow, right? Because
mhm.
we don't grow when we're static. When everything's just happy and everyone's kind of like, okay, this is how everything is.
Yeah.
So not to be afraid. I think for the practice owners, it's really important to be brave and at those moments to say, hey, this will pass, but this is means that something's good is happening rather than,
Yeah.
oh my God, the world is collapsing. So, and then pop a candy in, so you're not
Yeah,
freaking
Papa
out.
always comes back to the candy. No, I
Always carry candy.
I love it. And you know what? I think that's so important because I'm sure, you both can remember when you stepped into this role and everything was, new and you're figuring things out, doing things together. And then you can probably think about where you are now and like you're thinking, I can't believe I was freaking out about that. Like I
Yeah.
laugh about that stuff. Like that stuff is so easy. It comes so easy to me now. And it's because you leaned into it and you
Yeah.
grew together. And so, um, yeah, I think it's a good idea if people can picture their former selves of, a couple years ago and where they were at and what they know today. I would say a lot has changed and also for the better too. There's lots of things that you've learned and picked up and experience. So I think that's a great way to end off things here for our providers as well, is to lean in even when
That's
it's a
right.
little bit scary,
Yes.
um, and for everyone to pop a piece of candy once in a while.
That's right.
But this has been such a treat, you two. I so appreciate you coming on here and sharing your knowledge and your business with us and how wonderful you are to your communities from coast to coast. But before we leave off today, I'd love to hear from you both in terms of where people can find resources, where they can reach out, whether they are a clinician or they're seeking services. What might you recommend to them and sharing a little bit where they can find you as well?
So we are, of course, we have a website. It's revitalizingpsychiatry.com. We're also on social media. We have an Instagram and we're on Facebook. So on Facebook, you could just look for us as Center Revitalizing Psychiatry. On social media, on Instagram, you can look for Revitalizing Psychiatry. We have our page there. We're also on LinkedIn. But you could also reach out through our website. And in 3 locations. We have different phone numbers, but I think probably since, it's an interconnected world, just Googling us and putting either New Jersey or Florida or Utah, we will come up. We have a bright, kind of bright turquoise logo. And then if you can reach out through the website directly, we'll get those emails by calling us, by emailing us. We're very accessible. So we'd love to answer any questions.
And we don't require any formal referral. So we just literally, patients can just call us or providers can give us information with the permission of a patient that we can call them. But we don't require any special forms. There's usually not much of a wait time. We schedule most patients within 2 weeks, considering that the paperwork has been submitted. We have been told by patients that come to us, they were surprised that they don't have to wait for months to see a provider, and we always accommodate the schedules. So we're very accessible. We love to help out our communities, and we always answer any questions, and our providers are here for everyone to speak with them.
That's so awesome. Well, thank you, ladies. I appreciate your time today, all of your amazing insights, and we hope to have you on again soon.
Thank you,
you so
Rachel.
much, Rachel.